Hi everyone, welcome back to my channel. So today I wanted to talk about ruminations, OCD, intrusive thoughts, things like that. Um, so I've been struggling with this pretty badly for the last 4 months or so. Right now it's December 2021. So the tail end of this year has been pretty rough for me as far as psychological symptoms. Um, I think if you're dealing with any kind of illness that affects your nervous system, you more than likely are going to have some kind of psychiatric manifestation of your illness. So, again, that can be depression, anxiety, OCD type symptoms, ruminations, things like that. It's common with Lyme disease. I believe OCD is a symptom that comes with Lyme disease. But I think any condition that affects your nervous system, MS, stiff person syndrome, anything like that is going to affect your brain. And much like those autoimmune conditions, you go through flares. Some people will say, oh, I'm going through a bad flare right now. My back really hurts. I can't do much right now, but eventually it'll pass. Or, I'm going through a flare of headaches. It ebbs and flows. I think the same applies to the psychiatric symptoms. At least that's how it's been for me. Um, so for me, it has been the last 4 months has been obsessiveness. But in the past, I have had other symptoms. For example, like compulsively buying the same thing over and over again. So, for example, I went through a phase many years ago where I was buying cardigans. Granted, I wasn't spending thousands of dollars on clothing, but it was also weird because why would I need the same thing over and over and over again? So I would just buy like this cardigan, then another cardigan, then another cardigan. I went through that same phase with nail polish, with purses, with jewelry. So it and I know that it is part of my illness because it's abnormal. I will be fixated on it. It's almost like not in my control. It feels like my brain is doing this to me in a way. Um, you can also become obsessive over your illness. I have seen this with several other Lyme disease patients, and just people who are chronically ill in general. Um, I understand this symptom because your illness it dominates your everyday life. How can you not think about it when you're in pain every day or when you feel sick every day? This one makes sense, and it's almost the perfect storm because your brain has nothing else to think about is if you're stuck at home and your illness is just there 24/7. So I have seen this, for me, it happened to me early on in my illness, but I do see some people that become just obsessed with their illness. They can't stop researching it or, um, self-treating, doing just everything about their illness. They're just constantly on the internet looking for information. And I mean, it's healthy to a certain extent, but at a certain point, you really do have to kind of trust your doctors and let it go. But that's a different conversation. I've actually made videos about stuff like that. And then you can also become obsessed over someone or something, some entity. I don't want to get too specific into what's been going on with me over the last 4 months. That may come later. I may do a video on that in the future when I am out of this flare. Right now, I don't think I have enough clarity to address that. It's embarrassing as well. A lot of times we become embarrassed over the lack of control we have over our physical bodies, but also our brains. The fact that I can't stop myself from thinking about something over and over and over again and something that isn't actually serious. I mean, you would laugh if you knew what it was about. Um, so I spoke to my therapist. That was the first thing that I did to deal with this. And I highly recommend, if you do not have a therapist and you're chronically ill, I recommend that you get one. And I have made other videos on that before. So I spoke to her. I told her what was going on. It was embarrassing. And she explained it to me. She said, this is normal. She actually didn't think it was that big of a deal. And I told her, I said, it's not normal. So she said, it's normal. I said, it's not normal. And she said, your brain, much like your body, is going to cope. It's going to develop coping mechanisms in order to keep you alive and for you to survive. It's better for you to obsess over this thing over here than maybe your health or how bad you feel or upcoming treatment. She said it's a survival mechanism and it's helping to keep you alive. And it did make sense. The problem is that it didn't really help me. It didn't really make me feel any better, than before I had spoken to her. And I mean, that can also be my fault. I probably should ask her if there are skills, coping skills, things that I can do. But on my own, I have sort of discovered a few things that I can do to help with this. So you'll see another video, it may be up already or it may not, that I am changing my name back to my maiden name. And much like this weird obsession that I've developed over the last few months, I suddenly became preoccupied with getting my maiden name back. I never changed it back after my divorce because of my illness, because I felt that it was going to be too much work and too hard to do it. But suddenly, out of the blue, just like all these other issues I've been having, it just hit me and I was like, I need to change my name. And I have a video about that you can watch where I go into it more thoroughly. But I found this to be a really good project, like something to put my focus on so that the other ruminations could kind of take a backseat. And it has kind of helped. Because if you've never changed your name before, it is kind of involved. The harder part I have left up to an agency, but all the other smaller things, going to Social Security, going to the DMV, talking to my credit cards, all of that I'm going to do myself. And it's going to take a while. It's going to take maybe a few months to get all of that complete. And I thought this is a perfect time for me to do something like this because it'll keep my mind occupied and focused on something else besides this weird, bizarre obsession that I've developed. Another thing that I have done is a deep cleaning of my room. I did that this morning and I said, hey, I'm here by myself. I'm going to take everything out of my room. I'm going to clean my room, clean the floors, all of that. I'm still physically able to do that. It's something that's not too heavy for me to do. And it also kept my mind occupied for the time being. So I got that done. The other thing I've been doing is YouTube videos. I've had some alone time here at the house, and it's been helping me a lot to make these videos because it helps me to kind of talk about things, but also to connect with you guys and to make some content for you guys as well. It's something that gets my mind off of these other issues for a little while. I listen to podcasts. I've been listening to music. I have been watching a lot of YouTube videos from other vloggers and things like that. That's good, but it can also be bad because I'm just sitting, and it's kind of like mindless distraction. And I feel like at a certain point, it may not help as much. But for right now, I have been enjoying it. I've been watching like a lot of travel vlogs, things like that, even though I don't travel. I go for my walk every day as long as it's not too hot or it's not too rainy. I go for a 40-minute walk, but I know a lot of other people in a similar situation to me with chronic medical issues cannot do that. There's journaling, there's meditation. I've done something called paradoxical relaxation for many, many years now. It's similar to progressive relaxation. I was trained by a psychologist to do this type of relaxation. And in the very beginning, I was really, really good at it. The problem, though, with what's happening to me now is that I know that this is a physical manifestation of my illness. It's a symptom. And I also remind myself of that. I tell myself, this is a symptom that you're having. This is not that you're crazy or a psychological thing that can be helped with like an antidepressant or anti-anxiety medication. I'm dealing with a lot of inflammation in my body. So as that inflammation has climbed over the years, keep in mind 10 years ago my inflammation was probably lower, which is why I didn't have the symptoms that I have now, and over time the inflammation has climbed up. And so my paradoxical relaxation practice has become much harder. I notice that when I usually lay down to do these relaxations. I believe I have a video of it here on my channel. Just look up paradoxical relaxation. As I lay down to do them, I have like a recording that I listen to, and I just can't focus. And I know that this is because my brain is just so inflamed, my brain, my nervous system, that I physically just cannot focus. So for me, the distractions that help are actual physical activities or something like this where I am engaged and I don't really have the space to entertain any other kind of ideas with my head. So when you're doing a meditation or relaxation, I mean all sorts of intrusive thoughts. It's at this point I feel like I'm beyond that. I'm beyond being able to I'm beyond the mind over matter situation. And I think that's one of the things that psychologists may not understand is that when your psychiatric symptoms are coming from a physical illness, from damage to your nerves, for example, in multiple sclerosis, you have damage to the covering of the nerves. It's coming from actual damage. This is not something that you can meditate away. And it's the same with increasing inflammation, even like leaky gut, stuff like that. It can affect your brain function. And so you can't just, think it away. It's something that needs physical intervention. At the moment, I am on my IVIG. I do it subcutaneously, so I am on a medication regimen weekly, but I know that it's only going to do so much. And so I have been looking into other treatments, and that's part of the reason why is because of this weird obsessiveness. I feel like we need to pay attention to these symptoms just as much as the physical ones. Physically, I don't have a ton of pain or the level of pain that other people with my conditions have. I do have pain. I have experienced severe pain in the past. But like I said, all of that flares. I had a bad flare over the summer where I spent 3 months with abdominal pain. That flare passed, and then this flare started. I think we need to also consider these psychiatric flares as part of our entire physical profile, and also help it to guide our treatment, because these symptoms can be very, very dangerous. I can't tell you the desperation that I feel to get my brain to stop, to get it to stop thinking about the same exact thing every single day, every single minute of every single hour of the day. It is exhausting. It is emotionally draining. It is sad. It's hard. Sometimes I just feel like crying because I can't stop it. It's like torture. I mean, it literally is torture. And so I think to myself, even though my pain flare from the summer passed, sometimes when those flares pass, we're tempted to say, okay, well, I'm back at my baseline. I can deal with this. And I have been looking into other treatments, for example, stem cell therapy. And I was tempted to just say, you know what, I'm fine now. I can let that go because it's very, very expensive. And then when I started with this rumination, I was like, no, I can't let this go. My brain is also under attack. My brain is also suffering. And, it can be just as bad as physical pain. And sometimes I tell myself, would I rather have the physical pain? Would I rather have that stomach pain instead of this mental, anguish? And again, it's nothing that I should be upset about, but for whatever reason, it is causing a lot of anguish. So I am taking all of this into consideration when I look at what types of treatments, alternative treatments are available, and if I'm willing to do that. Because it's not pleasant. I mean, none of this is pleasant. A lot of people feel that psychological symptoms are not that big of a deal because, and I don't want to say because they can't kill you, but because they don't manifest physically, because they don't cause you physical pain, but it is really tough. It's really hard to, I mean, you can't shake it. This is not something, like I said, this is not something um, that is a mind over matter situation. It needs medical intervention. And for myself, I know antidepressants and anti-anxiety medication is not going to cut it because I react to every kind of medication. And so I'm looking at possibly more aggressive therapies, things that will reduce inflammation. And so my doctor and I are discussing those things right now. Um, it is tough. It is really tough. And the last 4 months have been very challenging. And I hope it goes away. My therapist, she told me, she said, it will go away. She said, eventually you will forget about this and you'll feel better. She said, and when you do, I will remind you. Because I told her, it feels like it's never going to go away. I've had episodes like this in the past where I become obsessed, maybe with someone, some guy that I'm talking to, or like I said, I'll buy something, compulsively, and then it eventually goes away. But I told her, I said, this feels different. It feels like it's never going to stop. It feels like it's never going to go away. And she said, it will. And when it does, I will remind you that eventually these things do go away. So if that's any comfort, if you're in the middle of a similar flare, just remind yourself it will eventually go away. It will eventually feel better. And just try to distract yourself in the meantime. That's what I have for you guys today. If you guys have any other techniques or tips, things that you do to help get yourself through a psychiatric flare, please leave it down in the comments because I am really interested in it. I need as many ideas as I can get because this is just absolute torture, and I'm over it. But it would be really interesting to see what you guys do in order to kind of get yourself through something like this. And also too, what happens to you during a psychiatric flare? What do you feel? What symptoms do you have? Is it, compulsive hand washing, which I also do that as well. It's just anxiety, panic attacks, depression. I know that it manifests very differently in all of us, also depending on our diagnosis. So it would be really interesting to share that information and to just sort of kind of crowdsource things that we do to cope. So thank you so much. Please like and subscribe, and I will see you again soon. Take care.